jump right into it, Eric, and try to give people as much data as we can today, and we'll save the sales pitch till the very last.
Sure.
If there is one. Hey, by the way, we do have a gift for everybody that's on the webinar today. Eric's put it up there on the screen. This is a little handout that you can see there on the right. We kind of zoomed in on the left there to show you that this is a benefits of outsourced medical billing. So if you're wondering why doctors would even want to outsource their billing to some medical billing company that's a third-party company, this is a great thing that we came up with for our licensees, and we're going to drop that into the handouts section right over there on your control panel for GoToWebinar. You'll see that towards the end. We're going to kind of tease you and hopefully keep you to the end so that you can get a copy of that just at the end automatically, free. You'll download it immediately. And Eric has dragged up this picture of me and my family. That's my wife, Linda, there, and our son, Adam, and daughter, Sarah. That is back in 1987. And the reason we're showing you that, folks, is because that's when my wife started actually doing medical billing. The business grew from there. I got involved in it. I figured out that people wanted to know how we did what we were doing because, you know, we bought a new home and a couple of new cars, and our friends and relatives were asking us what kind of drugs we were selling. That's the honest truth, because they thought, well, how could you be making that kind of money? You never leave home. Well, the great part about this business is Eric, it's what I call a secret home business that can make a six-figure income, and yet your neighbors never have to know what you're doing because it can be run from anywhere that there's an internet connection, of course. So over the years, we continued to build the business. We got to the point where, as you can see in this next picture, this is Linda and I here just a year or so ago, and we built this up into the nation's largest network of medical revenue managers. Now, we use that term because, as you'll see during the webinar, yes, we teach you how to do medical billing, but we go way beyond that, folks. We teach you how to actually manage the revenue cycle, they call it, for a doctor's office, which includes everything that has to do with the money coming into the office. And there's lots of facets of that you wouldn't get if you just took a course on medical coding or billing or something like that.
Absolutely.
So,
well, Patrick, I know that a lot of people, again, are asking, is this a legit business? Just the medical billing as general. And today, we just, Adam, your son, the one that we showed a while ago, well, he's actually grown up.'s the president of the company now. He sent this both to you and I today. And, folks, if you'll see here, I actually put a red circle around here so you can see the date. This is an article that just came out this month. It's with the Grandview Research, so it has nothing to do with American Business Systems. And, folks, if you want to take this down, just Google this out here. You can certainly see all of this. And, Patrick, you know, it's one thing that we tell you that it's a good business to be in. It's another thing whenever a research company is coming out. I'm just going to turn this over to you because there are some key words here that are just what people need to hear.
Yeah, and maybe you could circle some of this and highlight it, Eric, as I'm talking about it. On the left side there, folks, in that little infographic that you see there, the sum of this whole article is right at the top there. It's estimated this medical billing outsourcing, that's what we are teaching you and other people how to get into this business of outsourcing the billing to you. It's estimated to reach, in the United States, $16.9 billion by the year 2024. So, folks, it was only, well, you can see it in the first sentence of the article there, it was only $6.3 billion in 2015.
Right.
So look at the growth in this. Eric, if I were going to get into any business, I would look and research and find out something that's going to grow like this. It's just an incredible growth curve. And so, folks, if you're thinking about getting any business started, be sure and do your due diligence and make sure that the bar chart, line chart is going up, not down, as the years go by. And this one is certainly growing.
Yeah. So we've kind of marked up both of those right there, and you can see here, folks. Here are the problems. You can see here the current systems in practice for managing revenues are gradually becoming obsolete because of a lack of expertise in tackling new payment models and revenue management tools. So, folks, as you're going to see here as we go through today's webinar, we're finding we've got those solutions. And so that's what's causing our brand new licensees who've never been in medical billing business before. And with our assistance of doing these demonstrations, folks, we are literally tearing it up out there because it's just unbelievable of all the things that we're able and capable of doing, and including. Oh, go ahead.
Sorry, I was just going to say that we are recording this, and so you'll get a link, probably in an email or something, that will show you how you can go back and read this carefully and review it, and maybe show it to a spouse or partner too.
Absolutely. And Patrick, I know we always like to use third-party resources. So that first one was with that company. Black Book Ranking is another one. And again, here's just another statistic out there. All physician practices with employed billing staff, 24% hope to outsource their billing in the next.
You're dyslexic. You just said 24%.
Did I say 24? I said 42.
Play it back. Okay, well, anyway, the point is it's a whole lot more than you would even expect. So what this is saying, folks, is that physician practices that now employ their own billing staff, they're doing the billing in-house, 42%, that's almost half of them, hope to outsource their billing in the next year. That's, again, a good place to be if you're looking to get into a business.
Absolutely. And folks, what we're doing right here, we're just trying to share with you that these are reputable places that you can go to. Here's another one, Healthcare Billing and Management Association. It's a big, huge organization, HBMA. Again, another article, why doctors should outsource their billing. So we're putting all this out there for you so that you can do your due diligence as you're doing this. Again, trying to verify whether this is this the right field for you to be in.
Yeah,
there's 24 cents.
I'm sorry. What's that?
I said there's the 24 cents. It's 24 cents out of every dollar that are wasted on administrative billing.
Yeah, instead of 42%, yeah. Right. 24 cents. Look at that poor lady. She's wasting all this money on administrative and billing expenses as a doctor, when what she could be doing, of course, is outsourcing it to you. Now, just so you can quickly see the difference here between what a doctor is paying to have it done by their own staff, 24 cents. That's 24% of their costs. Of their revenue goes to the billing and administrative. Well, folks, you can take that off their hands completely and charge them as little as 6 or 7% and make a tremendous amount of money and save them, well, whatever the difference is between, say, 7% and 24 cents. It's a win-win situation for everybody. And, yes, this is from the New England Journal of Medicine, which is no organization either.
Now, I'll let you try to say this doctor's name, and I'll just be quiet for a little bit.
Sharon Watton-DeCo. I don't know if that's right or not, but we'll just call him Dr. Verne. This is a doctor, by the way, who was interviewed in U.S. News and World Report, and he says in that article, to get paid by the insurance company, I have to pay about $20 to collect it between the person that bills. He's talking about the computer system, the ongoing support, the upgrades, the updates, and so forth and so forth. About $20 per claim. Now, folks, you can get that down to as little as let's say it's a $100 claim. Well, it's $20 for a $100 claim. You get that down to $6 or $7 that you could do it for the doctor. So the doctor saves money. Why? Look, if you're asking why a doctor would outsource, why would he not when he sees these figures? They just don't know, do they, Eric?
No, the doctors just don't know. That is correct.
Yeah, and once they're educated by you, by sharing some of the data that you have in that book that Eric mentioned earlier, we'll talk more about it here in a moment, they're sold. They basically get sold by us, by the information we give you to give to them, and then when we do the live demos of the system, Eric, whoa, they're just blown away, aren't they?
They certainly are. And folks, it all starts with what we do for you. Obviously, we're going to train you. We have a live training that takes an entire week long. We do this about every 6 to 7 weeks apart. And we're going to train you, and not only are we going to train you, we're also going to certify you, again, as a certified medical revenue manager. And that is key. That kind of moves you away from just being a medical billing company as really, what I like to talk about it, Patrick, is more of a performance improvement of a doctor's entire revenue and really their entire office.
It is. And folks, that is a certification, by the way, that we give you at the end of that week of training, although there's continuing training that's ongoing training for you, even after you've gone through the live week's workshop. But we certify you, we give a nice certificate, you can put those letters after your name. It is a certification that shows the doctor that you have been certified as a medical revenue manager. And boy, the revenue cycle, there it is right there. Eric just put it on the screen. That has to do with the claims preparation, the submission of the claims, the management of that claim once it's in the system, and then, of course, the reporting on the back end, including knowing how to, follow up on denied claims and things like that. But Eric, talking about the denied claims, I don't know if you have a slide later on this or not, but we've got our rejection rate way down because of our cloud-based system, don't we?
Yeah, I mean, it is, because the system what we're using, folks, we've talked about this on other webinars, but what you'll find out with, and what we encourage you to do is check in with your business coach, the person that sent you an email to actually get to the webinar. They can arrange and showing you a demonstration. Once you see it, you get it. You can just go, wow, why doesn't every doctor in America have this? Yeah. So it's completely wide open out there, and we can prove it by doing these demonstrations and then associating that with all the other services that we have. You truly are more than just a medical billing company. We're going to help you get there.
Yeah, so you basically think of it this way. Anywhere you can get to a computer, any computer, PC, Mac, your iPhone, your iPad, your tablet, any device that's connected to the internet, you can actually run our system on that from anywhere at any time. Nothing is downloaded to your device, so it doesn't matter. As long as you have a browser and you can connect to the internet, you can start doing this business from anywhere. Eric, we've had people in RVs travel around the country doing this business. We've had them go to the Bahamas, and out on the beach they run their business. It's just it's incredible. And of course, we include all the other ancillary services that you see right there on the screen, folks, that you can learn more about on our regular website that you see at the bottom of the screen there, absystems.com. So in this webinar, we're not going to go into detail into these ancillary services because that's just what they are. They're not the main focus. Your main revenue is going to come from actually doing the billing for the doctor.
Now, folks, before we go any further, because the next slide we're going to be showing you is actually asking a question. So let me remind you that anytime during the webinar, feel free to ask a question to Patrick and me anytime during the webinar. Sometimes we get a lot of questions. Sometimes we don't get a lot of questions because we're answering a lot of questions as we're kind of going through this. But Patrick, I know I just got off the phone with, I believe it was Chris. Chris, you're on the phone here this afternoon, so thanks for joining us this afternoon. One of the questions he actually had was, what about us? Here at ABS, what about franchise fees? Are there any franchise fees?
In a nutshell, no. In fact, there are no fees of any kind. After you've paid our one-time, lifetime licensing fee to go through our live training, to get all of our proprietary marketing materials and ongoing support, access to our website for licensees, once you've paid that one-time fee of $25,000, that's it. You will never pay another dime to American Business Systems. Why? Because we actually make money on the back end as the claims are going through the system. A few pennies of each one of those claims come to us. Now, that's not money that you pay us. That's money that's paid through the doctor. The doctor's covering all of your costs on that system, including the processing of the claims. But we make a few pennies on each one of those. So we are going to give you lifetime support. As long as you're sending claims through our system, we want to support you. And we want you to get more clients and build it as big as you wish. And that's why some of the quotes that you saw there on the slides, those of you who got here early, saw some of the success stories from licensees. Some of those licensees have dozens of doctors, some of them hundreds of doctors that they're billing for. And we make money on each one of those, so we don't have to charge any kind of royalty fees at all.
Yeah, so we wanted to make sure that as you're doing your due diligence, we have actually pulled some information even from Entrepreneur website to show you that you need to be careful, because you've got to remember that with some franchises, you could be spending up to 4 to 6% of your gross sales in going back to that franchise. So again, with us, as Patrick said, there are no franchise fees ever, and there are no royalty fees ever with American Business Systems. So again, as Patrick...
Yeah, there's no support fees. You don't have to pay a support fee each year like you do with some business opportunity companies, and their packages include yearly annual support fees. Ours is unlimited for as long as you are an ABS licensee, for your lifetime, in other words. And there's no user fees. You can have as many users on our system as you want to set up on there. You're the administrator of the system. There's just no fees, period.
Yep.
It's getting simpler than that.
Another question that's always been asked about is what about territory restrictions? Now, Patrick, I know that we've talked about it, and before we talk about that, I actually had some information here that, again, is from the Entrepreneur magazine. And just so people understand, what is a definition of a territory? And basically, it's a defined area. It could be a zip code, could be all different sources. But what I found interesting is that some franchisors like to they're in the market of just selling franchises. So you could be right next to somebody and then not have anywhere to be able to go, or they give you kind of an exclusive territory. But folks, let me show you your territory here with American Business Systems.
Oh, it's the whole United States. And Eric, you wouldn't want to have a territory restriction on this business, would you?
No.
Because think about it, folks. Let's say you sign up a doctor in your own area, and that doctor's happy with what you're doing, and they know a doctor that's in another state. Well, they're going to tell that other doctor about it. There's nothing you can do to stop that. This business is going to grow organically from the referrals. And if that doctor refers that other doctor to you, and you say, "I'm sorry, I can't handle that doctor," that's not good. You want to be able to handle all the referrals that you could possibly get, no matter where they're at. So we literally have licensees that you can talk to that are in this business that have clients all over the entire United States, which is a great thing because those doctors know other doctors and know other doctors, and it just grows, and it grows out of control. At some point, Eric, people actually have to make a decision, right? How big do I want this thing to be? How many people do I want to manage, and how many clients do I want to have? And, of course, we have ways of handling some of those, what we say, excess clients as well, right, through our network of other licensees. And you can share in the profits with other people. So it's a wonderful business to be in.
Well, and another thing, Patrick, that people do ask is, what if there are other licensees in my area? I know that, and I like to kind of talk about that here because we're talking about territories, because they may think, well, if I'm right next to another licensee, then that licensee probably has all the doctors in that particular area. But what you're going to find, as I said earlier, you may have a licensee right next door to you, but it doesn't mean they have doctors in that area, because they do know themselves their territory is wherever they can get a client. It may be upstate New York and they live in Texas or wherever it might be. So really, even the closeness of another ABS licensee doesn't even really matter as well. That's what's good about this.
Yeah, and when we look at the income potential here in just a moment, you folks you'll grasp that even better, because people think, oh, I got to have several dozen clients maybe to make a good living in this business. No, you could have a literal handful of clients and make a six-figure revenue in this business.
Absolutely.
So it's not like you have to have every doctor that's in your area signed up. A handful of them could make you a very nice, maybe replace your current income and maybe your spouse's as well.
Absolutely. Patrick, I think you've already answered this question about ongoing or update fees, and especially in the medical billing world, I know that a lot of doctors are concerned with their own updates and fees that go along with that. But again, we don't have any, because it's a web-based cloud. It's a web-based system. There's no need for update fees as we go through this.
This is another place where some companies will mislead people. They'll sell them a piece of software. Sometimes it's a server-based software that comes on a CD, and then they want to sell them updates whenever they have a new update. Oh, you better update it, or you're going to be crashing and all that. And of course, there's new codes that come out, medical codes, and so they'll charge even for more updated medical codes. That's where they get their back-end revenue with several $100s a year in update fees. Folks, we don't have any of those. Anytime we come up with any new features, the next time you log in, you're going to see those features. It's all done on our servers back in the background, and you're just going to see them and start using them and benefit from those. Same way with the codes. Medical codes, when we came out with the ICD-10 codes last year, Eric, none of our licensees had to download or install or do anything. They were just there in the system automatically.
Absolutely. Before we go any further, I'm going to take a couple of questions here. Steve, you're asking a great question, because, as a matter of fact, you're the second person today that's actually asked this question. And that goes back to the certification, Patrick. He's asking, how often do I need to get certified?
Steve, ours is a one-time certification. Although your learning, your training is ongoing, that certification is good for life. There's no reapplying or taking tests or coming through another training class or anything like that. That's a lifetime certification.
Okay, and let's see. This is Deanna. What about all of these private physicians that have most all joined these large managed group cares, or care groups? Don't those managed care groups process the claim for themselves? Examples in California, we had Sutter Healthcare and Mercy Healthcare. Deanna, that is true. Whenever a lot of these doctors, when they do join these here, obviously they've got a large medical billing practice. But also, let me say, if you're telling me you're out of California, the young lady that came through training 4 weeks ago, she lives in California. She's already signed up 2 doctors, a cardiologist and a family practice. And that family practice is not only does it have a family practice, a doctor there, but there's also a physician's assistant that she's going to be billing for as well. So just understand that not all doctors are joining all these big groups either.
Yeah, Eric, there's such a thing in psychology called confirmation bias. That simply means that depending on your outlook and your worldview and your contact with the world, you might see a certain situation as being a certain thing. Like this lady has said that she thinks that all the doctors in private practice are signing up with the groups. That's not true. You'll find that when you go out in the marketplace and start talking with people like we teach you to connect with those doctors through networking groups and other ways of marketing, that there are just lots and lots of doctors who want to stay in private practice. And so all they're looking for is a way to keep their cash flow to the point where they can afford to stay in private practice and not have to go join some of those groups that are out there. We are the company, we're the organization in America that's helping doctors do that. That's why me and Dr. Vicki Ragnar wrote the book, The New Thriving Medical Practice. We're going to show you how to educate those doctors where they want to thrive. Eric, I'm sure that these 2 doctors that Jennifer just signed up because they read that book, or at least the chapter where we cover all these things about cash flow, and they realized that this person might have the answer to that. So we've set you guys up, and Jennifer, for example, as our licensee, as the expert, the person that they need to connect with that can solve that problem for them so they can stay in private practice and thrive in doing that.
Absolutely. We've just generated a whole bunch of new questions here, but let's ask this question, Patrick. Is there a limit of the number of clients that one person can do?
Well, yes and no, right, Eric? There is no limit. You can sign up as many as you can handle, but you can only handle so many, right?
Of course. But we're showing you that really the field is just completely wide open. I mean, a lot of people think, well, I've got a family doctor, I might know a cardiologist, but folks, we've got up here just an entire list of other types of what's called providers out there, medical providers that are out there that you could actually do billing for.
And Eric, I honestly can't even read those. There's so many of them, we had to squeeze them all on one slide here. But folks, if you look carefully, you will see some things on those you probably never even heard of. You'll be surprised at how many specialists there are in the medical field in your area. We're going to show you how to find those people and connect with them, the best ones that you should be approaching, the ones you shouldn't spend any time on. That's all taught in our week-long training class here in Dallas.
Yep, there you go. Carolina, you're asking how much is our business opportunity here. It's a one-time fee of $24,990. We're going to talk a little bit more about that there at the end, too, as well. And let's go to the next question on the slide. This is what everybody wants to know about. What are the potential earnings, Patrick? I think this is where you were leading up to just a moment ago, because everybody obviously wants to know what are they going to make and how much can they make?
Well, before I address that, though, let me just address the elephant in the room. The elephant in the room is that the licensing fee right now is $24,990, but that will be going up soon, folks. We're already having discussions in our board meetings about the fact that our license price has been $24,990. How long, Eric? 8 years, maybe?
Yeah.
7?
Yeah. 7 years.
So,
yeah.
So it's going to go up next year. Now, we're still deciding what that price ought to be. It could be $30,000. It could be more. It could be less. We just are deciding that right now. But I'm letting people know that because at the end of this webinar, we're going to show you some of the reasons why the price is actually going to be going up. But anyway, let's talk about this one because this is the question that's in people's minds. When I get into business, well, Eric, I think the first question is, what if I never get a client? Right? I mean, isn't that the real question is, what if I never do anything? If you never do anything with this business, it means you went home and put it on the shelf and didn't do anything we taught you during the week that you're down here. Fortunately, we have a money-back guarantee that we'll be reading at the end of the webinar today that gives you the assurance that if you come down here and you decide this is not for you for any reason, you can have all your money back. So there's no risk. But let's talk about the money, the potential earnings. Now, big word there, potential, right? Not everybody's going to make what we're about to show you. And there's no guarantee that anybody will make anything, right, in any business. Like I said, if they go home and don't do anything with it, they're not going to make anything. But we do have a little calculator there on our website. Eric's showing it to you there. And it's under that middle tab there, that menu, Income Potential. And it's called the Income Calculator. And when you get there, you're just going to fill in, looks like 5 different figures here. Number 1 is the number of doctors that you'd like to have as clients. We've got 1 already in there. 20 is the average number of patients that a doctor can see in a day. Eric, that's not necessarily true. A general practitioner can see 30 and 40 a day. But anyway, we started with 20. 5 days a week that they're working. Maybe they take off 1, so you might change that to 4 just to see. But then the charge. All right, now we've got 6% in there just because we wanted to be on the low end, folks. It can be as high as 7 or 8% in many, many cases. Licensees charge even more than that. But even at 6%, if the average claim is only $100 per claim, let's push the submit button here and see what our calculator comes up with. Ready? Drum roll. It's coming. Hold on. There it is. Your total yearly gross income could be $31,200. Servicing just 1 office.
Yeah.
So, Eric, that's why I said earlier, people don't need dozens of clients. They might just need 1 or 2 to replace their current income. But certainly, if we're talking about a handful of 5 clients making $31,000 apiece, that would be good. Now, some of them are going to make more than that for you, and some will make less. Again, that's what all the disclaimers are for there in screen. But the point is, you can plug in your own numbers and see what you come up with there. Now, Eric, the question usually in people's minds, at least, is how did we come up with it?
Yeah, absolutely. How did we get there? So what we're going to do, we're going to demonstrate this for you because I know a lot of people are scratching their heads and going, okay, well that's a pie in the sky number. We're going to take it down to real reality. So again, we're going to use 1 doctor, as you can see here. We've got 1 doctor that again is going to see 20 patients a day. Now we've got to think like the doctor thinks at this point. What is each one of these patients? What are they valued at? So what it means is what at the end of the day, I see this patient. How much money am I actually going to end up collecting? And each one of those is valued at about $100 per patient. So again, if the doctor's seeing 20 patients a day and they're charging $100 per patient, that's about $2,000 a day. That's what the doctor's making.
Yeah. Now let me point out too, Eric, that's the money that we're assuming that the doctor actually collects. He could be billing an insurance company $140 or $50.
Right.
But we know he doesn't collect all of that from the insurance company. So we've, again, tried to be conservative there and say it's only $100. This is to make the math easy because we have to deal with zeros.
Yeah, because the doctor, I mean, obviously, this is $2,000 a day is about the minimum for a doctor just basically to break even. So obviously,
to keep his doors open, to pay the overhead, the staff, the insurance. Yeah, he's got a big nut to crack there each day. Yeah.
So let's now we're going to try to start driving it down here so you can see how the calculations are done behind the scenes. So you get $2,000 a day, right? Then you're going to use your 6%. 6% of 2,000. Again, your average earnings on that comes out. Now this is going to be a per day. We're going to show you first of all. It's about $120 a day. So that's not bad for about 90 minutes of work. So think about that. You're doing about 90 minutes of work per day to actually process medical billing claims. You're making $120 per day, or almost what? What is that? Almost $90. I don't know, $80 per hour or something like that. I guess that would be it. Average that, something like that.
Well, and the point is that it's only 20 claims. Literally, when you see the demo that we show you, you'll be doing those claims with some of them in 30 seconds. It's not a whole lot of time that you're really going to put into this. But we've been generous again with showing that it's 90 minutes for 20 claims. Yeah.
So then let's take your average earnings of $120 a day, 5 days a week. That's going to be $600 times 52 weeks. There's where you get the $31,200 per year per doctor. So at that point,
we know that's reasonable because I don't know about you, but I've been in a doctor's office when there were more than 20 people waiting to see the doctor, in the hour that I was there.
Right.
So we know that the number of patients is right. We know that that $100 is low as far as per patient. And so these numbers are real, folks. But again, do your own, go to our website, plug in your own numbers, and see what you come up with.
Yeah, so that kind of gives you an understanding that, first of all, we're trying to be as transparent as possible as we can make it. And again, we're using the lowest amount of numbers that we can make it here so that you get a good grasp. Obviously, there are some licensees that are making much more with that, again, with at least one doctor, and still working about an hour and a half a day per those doctors.
Yeah, because the real decision they have to make, Eric, is what happens when I run out of time or I don't want to put in more than a certain number of hours doing this myself. Now you've got to hire somebody else. But that's easy to do since it's a web-based, cloud-based system. You can hire anybody in the world that has an internet connection to do the billing for you and just manage those people using the technology that's available like this one that we're using here for these webinars.
Of course. Now, we got this question here, but Chris has asked the same questions. Do franchisees, actually we call them licensees here, but do franchisees compete with each other? Can they undercut another franchisee and take their client away from them? That's a great question as we lead into what about competition?
Well, first of all, in 22 years, we've never had that happen. We don't have licensees stumbling over one another. If that ever happened, of course, we're in the free enterprise marketplace. We, as licensors and trainers and supporters, have nothing to do with what you and some other business owner. You might be competing not just one of our licensees, but maybe another medical billing company in your area. And so you do the same thing with those that you would with one of our licensees. You would compete based on what you think you have that's better or equal to service-wise than that other person. We've just never had that happen. And Eric, I guess the only reason people come up with this is because they're concerned with the fact that maybe the marketplace is so small in the area that they're in. I don't know. But again, folks, go to Google. Just Google medical specialties or medical providers in your zip code and see how many there are. There's literally, in the Dallas-Fort Worth area, Eric, there's something like 25,000 different medical providers. So you could have dozens of licensees in this area. They couldn't handle all the businesses out there. It'd be like saying, now let's see, you think we could take another Allstate insurance agent here in the Dallas-Fort Worth area? You think maybe there's room for one more of those? There's dozens of, hundreds of them probably. It's just too big a place.
Oh, yeah. So, Christopher, we answered the question about, closeness of ABS licensees together. Now let's talk about the competition as medical billers and medical billing. What we're going to show you right here really sets us apart. Patrick, you want to kind of work through this, and so you can help differentiate why our system stands out over all of the other billing systems that are out there.
Okay. Up in the upper left-hand corner, we've illustrated what we call our patient portal. Now, this is a cloud-based system that's it's a part of our system, but it's kind of separate in that you give access to the patients, or I should say the doctor gives access to the patients to the patient portal. This allows them to log in, make appointments, see their past appointments, see their history of all of their prescriptions. Everything about their health is right there in this portal. But that portal is intricately tied into the same database behind the scenes that the doctor uses when they are seeing the patients. So in this case, we're showing the doctor using their iPad when they're actually visiting with the patient and interacting with the patient. During that patient visit, the doctor is tapping a few buttons on that screen that puts data into the system that then goes directly to you, the medical billing company, in what's called iClaim. So the doctor's using our electronic medical records, EMRX. You're using iClaim to do the actual billing and follow-up of the claims and so forth. And inside of our system, folks, is what's called a clearinghouse. Now, in most cases, other companies, in fact, all of them that I know of, Eric, all of them outsource this clearance of the claims through what's called a third-party clearinghouse. That's a third-party entity that's set up to scrub the claims clean and make sure that they go through and get paid. And then they send all the data to the insurance companies, and that insurance company, of course, is then paying the doctor directly. We don't have to outsource ours to a third-party clearinghouse because ours is the clearinghouse. We are the clearinghouse. Very unique in the marketplace, Eric. That's probably why our rejection rate. Well, you and I were out in California last week with some of our technology partners out there, and we heard them actually say, I asked them if our rejection rate was still below 2%, and they said no. It's now below 1%. Below 1%.
Yeah, absolutely. So, folks, what makes this different is that, and the way that I like to explain it also, and it helps us understand, is that imagine that this is sitting outside of a billing system. Well, then I'm sending information to this clearinghouse, and then it's taken over to the insurance company. Think about this, folks. This gives us direct connections with every insurance company that is out there, and we can communicate both ways. So this is a huge, huge advantage for yourself in going into doing the medical billing. Matter of fact, Patrick, this is the thing that I showed the doctor yesterday for Jennifer Boyd that blew the doctor away. He had no clue that there was anything out there in the marketplace that had that. Literally, I think I did the demo for less than 30 minutes. It took 30 minutes for me to show the doctor the advantages of having our own clearinghouse inside the system. He said, sold, done. Let's sign the contract and let's get this thing moving.
Yeah, we hear them gasp sometimes as they're watching these live demos. Remember, folks, we're doing the demo. You, as the licensee, have just introduced the doctor to us, set up the time. We have an online system that lets you arrange for the demo to be done. At their computer, you can be at your computer or they're in the office with the doctor. You're watching it at the same time, and we hear them actually gasping, saying, wow. I mean, that's what we hear more than anything is wow. And then at the end, of course, well, how do I get started? Okay, here's some of the great features that Eric is showing here. You can draw on your finger with the iPad. I saw that just for a second. Then you can also, okay, and then you can also do e-prescriptions. I know you're trying to hurry because we're out of time already, aren't we?
We're getting close.
So, folks, we have online prescribing. In other words, the doctor can touch a few buttons, prescribe for the patient, and it's actually in the hands of the pharmacy electronically before the patient leaves the office.
Exactly.
So, incredible technology. We have all that built in already. What else, Eric? Oh, mobile. Yes, he can do that on his phone even.
Yeah.
The doctor can be at the golf course, and you call the office and say, hey, I need some pain pills. Please get a hold of the doctor. They call the doctor. He pushes a few buttons, and it's sent to the I'm just making this up as I go. I don't know. I guess that's a good illustration. Get him on pain pills. Okay, and then Eric's also job here putting together some of the awards that our system has won. Folks, if you're wondering, do you really have the leading technology that's out there? What's going to set you apart from all the competition? It's the fact that you have all these certifications and awards for the system that you'll be offering to the doctor as part of your service.
Absolutely. I know we've got a ton of questions, so we're going to try to get through as many of these slides, and then we'll take what we can and try to go through so much of this. But as we kind of wrap this thing up, this is the thing, Patrick, that I think I showed the doctor yesterday that really made the difference. And folks, we know that the two books that Patrick's written, Cash Crunch to Cash Flow and The New Thriving Medical Practice, all has to do with trying to get as much cash into that doctor's office. So one way that we can do that is to allow our system to do these what's called insurance verification, and it's built into our system. And the reason it is the only system that has this is, again, because of what Patrick said. It's because we own our clearinghouse. And I'm just going to kind of take you on a quick little tour as though we're doing a little demo, just so that you can see what we're talking about. But what you'll normally see in a doctor's office are people that are actually trying to do this insurance verification, or what's known as an eligibility check, by actually picking up the phone and calling the insurance company. Now, that's not proficient in a doctor's office. It slows the office down. People are trying to verify, does this person have insurance? Because we're about to send this patient to the back. We don't know. Our system will check that instantaneously as we're going through that. So that's what I'm going to show you here real quickly. We're back in the I-claim side. And you see this part right there where it says eligibility request. And you're going to see what we're going to do here. So imagine that you're going to give a new tool. And this is where the performance improvement part of it really comes into play. You're going to give the doctors a tool in which they can click on this. And this is really the office staff. And they're going to select which payer that they're going to do a search on for that particular patient. In this case, we're going to look up at Aetna. And once we put in all of the pertinent information that's on there, we can go to Aetna, pull in all the information for Aetna, and including seeing that this patient is active. Then we can even take it a step further. We can go and pre-fill the entire patient chart directly into our system without anybody having to type in anything else. Folks, if you would like to see that in live motion, contact us here at American Business Systems. We'll be happy to do a live demonstration for you so that you get your, what I like to say, kind of get your head wrapped around this, and you yourself, you'll go, my goodness, you would think that all doctors should have this. And Patrick, we know that barely, I don't even know what the percentage, but it's so low that doctors just don't have this type of technology. They think the only way that they can have this technology is, again, trying to join a hospital group, and they don't have to do that. We can keep them independent, and that's what we want to do.
This is why doctors are struggling to stay in private practice. They don't have the right technology, and we can provide that. You can provide that through our company. Okay, Eric, what else? Oh, there's the scheduler. Love that. Okay. And are there any charges for live demos? Well, we should be charging, Eric. I mean, really. What are these demos worth to a licensee? Hundreds of dollars, really.
Well, it could be their
live demos.
I'll tell you what let me tell you what it could be. It could be their return on investment. That's what it could be. Their entire return, if they're paying $25,000, one demo could recoup their entire investment with American Business Systems.
Oh, yeah. Yeah, because one client we saw could earn them $31,000. And even if our license fee went up to $29,990, it would cover that, wouldn't it? So, absolutely. No, those live demos are invaluable, folks, and we do those as many as you wish. As long as you're an ABS licensee, we've been doing those for years, and we love doing them because it brings more clients to the table. You make money, we make money. It's the American way.
Absolutely. All right, Patrick, it looks like we've got about 10 more minutes up here at the top of the hour, but I know one of the things that you wanted to show here also, again, just to kind of have a third party, say in the matter, is medical billing a legit business? And obviously, we're even being shown as part of the entrepreneur startup. If you're going to start up your own medical billing company.
Yeah, in fact, I've got that book right here. In fact, Eric, that is a great point that I don't know where it's at. But that book, it just came out. It's by Entrepreneur Magazine, which has been around for 40 years. And they have a series of books on how to start different businesses. This is one, starting your own medical claims billing service. And we're telling you, folks, that you can pick this book up if you want to. It's like $20 or something like that on Amazon. But notice that it lists in the back of the book our company under medical claims software clearinghouses and business opportunities. Why? Because we are the leading provider of this type of opportunity in America. We've been doing this for 22 years. And there's not many people that have been around in any business for that long, much less this particular one. So we have got, folks, the credibility of saying from Entrepreneur Magazine that, yes, this is a valid business. We published a book on it. And if you want to know more and maybe purchase a business opportunity, here's a company that offers that. So there we are, right there in the book.
Absolutely. And so, folks, for everybody that has stayed in this entire webinar, Patrick said he's going to send you a gift. Patrick, you want to go ahead and throw that in over to the handouts? And so,
yes, I am. Hold on just a second.
Sure.
things popping up on my screen here that may have just crashed my entire computer, but I'm going to pick out this one handout and drop it in what's called the drag and drop file. I don't know if it's going to work or not, Eric. Let me see if I can do that now. Hold on just a second.
Sure.
I don't know. Still having problems, technology problems here. You go ahead, and I'll see if I can work on that.
Yeah, go ahead. And what I'm going to do is, while he's trying to do that, I'll do this part where, folks, we want to make sure that you are 100% satisfied with your decision about coming on board with us here at American Business Systems. And so this is something that Patrick came up with a few years ago, and it's just been really a lifesaver for a lot of people, because a lot of people don't know, but because we're talking with you over the internet, we're talking to you over a telephone, you see us on webinars on a weekly basis, but we really want you to be a part of the training. So what we have written in our purchase agreement is really, like he says, no wiggle room here. And it says here, just plainly, if at the end of the training workshop, for any reason, you do not think this business is right for you, simply tell any of the staff members and we'll arrange for you to receive a full refund of your license fee. Folks, there's not a business opportunity out there in America that will even attempt to try to do that. And a franchise will not even try to attempt to do that. Folks, when you have your money with that particular business, franchise or business opportunity, then they feel like, okay, well, I've got your money. There's nothing much more than I need to do. Folks, we extend that as you come by and visit with us here at our live training, and we want you to be satisfied with that. So whenever you're looking at trying to get involved with us and trying to get involved in wanting to even come up to one of our next training classes, I've got our training date that's coming up here. It's literally within just a week and a half here, October the 24th through the 28th. We do have about 2 seats left available. We just added a couple more right before the webinar, so we were able to this is the most updated number that we have at this point. But there is one more training class at the end of the year, and it's December the 5th through the 9th. So there is one more, but folks, don't wait, because again, as Patrick mentioned, at the first of the year, we are going up on our price because there's so many new features that we're actually adding in 2017. It won't be a big jump, but it'll be it won't be $24,990 anymore. This is our last year to be at that price. So be considering whether October might be your class or maybe the December class. Talk with your business coach that you're working with. We're always pretty flexible about so many different things. So give us a call here at 866-565-8413, and we'll answer any more questions that we have for you. Now, I think Patrick had to pop off because I think something happened with his computer. However, I'm going to do what I can to answer some of these questions. I'll go up to the top of the hour. Folks, if I can't get to all your questions, because there are really a lot of questions that have come into play here, so I'm going to try to get as many of these in as before the top of the hour. So everybody that's hanging on, there's really a lot of people on here, so just bear with me. I'm kind of flying solo right here. So the last question that we left off of was with Chris's and about competition with other franchisees. Cash, you're asking, what does the training cover, if you can briefly tell in quick points? Well, really quickly, what we do in our training class is that day one, we're going to help you understand what medical billing is all about. We're going to actually have hands-on, as you can see here, the screen that up here. But really, what we're going to make sure is that you get very familiar with the iClaim, the EMRX platform. But then the rest of the week, Cash, just like everything else that we're going to do, we are really going to help out and work very specifically on helping you get a client. So the rest of the week is on marketing, what to do, how to use that book. Let me put that book up here so that you'll see what we're talking about, the new Thriving Medical Practice. We're going to actually show you how to use that book, how to mark it up, leave it with a doctor. I'm telling you, this gal, Jennifer, that's what she did. She put this in the hands of the doctor. She had it marked. Both of the doctors ended up reading it cover to cover, and then got her in there to do the presentation and everything. So looks like we got Patrick back. Patrick, did you get a chance to drag that over, that thing over? No? All right, folks, so we owe you one, so we'll see what we can do to get you emailed. For those that are on the webinar today, we'll see if we'll just get this out to your business coach. We'll have them email that out to you directly.
Yeah, I do have this one thing here that I could show, Eric. Somebody asked a question about what we're covering on this. Let me switch here and see if I can do this. I have an actual document here that lists some of the topics there during that workshop training. So there they are, folks. If you're just wondering what we cover a lot. About a dozen different ways to market, as well as all the different ancillary services. We go into detail about medical billing. We got glossary and terminology and all kinds of stuff there. So it's a lot.
There you go. All right, I've lost my, oh, there it is. There we go. All right, so we're going to put this back up over here. Let me get this started and show my screen here and then put this back up here. There we go. All right, so we left off with Carolina. Carolina, you've been asking the question about financing, finance help. We don't do financing here directly at American Business Systems. It is a one-time fee of $24,990. And we have some possible resources. So underneath our website, if you go find out where it says how much does it cost, you'll also see some funding options there. So go check us out there on our website under that. Again, if you kind of get lost where to go, again, check in with your business coach. They'll be able to help you out there as well.
Eric, I jumped off there for a minute. I see one of the questions about the December training dates. They didn't catch that. It was December 5th to the 9th.
Right.
Yeah.
December 5th to the 9th. I'm going to kind of just go through some of these quickly because I got them still pulled up here. Claire, you're asking, is there any help with the system / program to assist the providers with getting their payer contracts going? Yes, that's with another part of one of our services that we have. So Claire, yes, that is. We've already talked about the money back guarantee. We got that. Steve, you're asking, do you need insurance? You're probably thinking about any type of errors and omissions insurance. There are some licensees that consider that to be very valuable. There are some that don't. It's really up to you. It's a business decision. When you get here to train, ask Cynthia. She'll tell you all about that and be able to help you out with that. Deanna, how often are the cloud-based applications updated? Great question. Patrick, I think we were with our group there in California last week. I think it's every week that there's something new that's being updated. Is that what you remember hearing?
Right. Once a week, they try to release all of the different updates all at one time so that when you log in, you see all the updates listed there on the initial screen. And so there could be several different things that happen, but we could literally do it every day, but then it might be a little confusing to some folks. But every time you log in, once a week at least, you'll see all the updates listed right there on the screen. Eric, did you answer Tim's question there about how has Obamacare changed the business?
No, I'm actually going to get to that. There's actually one right before that. Steve's asking the question, how often is the system down for you or for the doctor? Never. It's, we have to put that disclaimer, less than 1%, but it is 99.9% of the time up. So it's
when we do take the system down for any reason, you're given notice, notice ahead of time, and usually it's like 3 a.m. on Sunday morning, something like that. Yeah.
Whenever it's nobody's yet. You want to answer that one there for Tim, though, about Obamacare?
Yeah, we kind of thought about that back in 2008, I guess it was, when we started talking about Obamacare, the Affordable Care Act. It basically has not affected our business at all, except in a positive way, and that is that the doctors who are staying in business and trying to deal with Obamacare, they have that many more patients to see. And so even though there's some doctors that decided they didn't want to deal with that at all, the great thing is that the licensees are having the problem now of having to deal with so many doctors that now have so many more patients that they have to see, so they don't want to deal with the billing. They outsource the billing. So it's been a good thing for us.
Yep, there you go. All right, I think we've answered most of those. So Sophia, we got yours. Sophie, we got yours, the December class. Sheila, will it be possible to send me a link so that I can watch it later? Yes, folks, we send out the recordings on Saturdays. So if you're listening to us, this recording will actually be sent to you on Saturday, so be watching for that. Thanks for answering the question.
Post it on our website as early as tomorrow.
Yeah, it could be available as early as tomorrow.
Yeah,
Carolina, go ahead.
Yeah, go back to absystems.com, click on News, and then Blog, and it'll be posted there, usually within 24 hours.
Yeah. Two more questions here that we've got. Carolina, you're asking, how do you get paid? Since you're an independent medical billing company, you're going to be actually paid directly from the doctor, not from American Business System. So you'll have a contract agreement directly with the doctor. The doctor will pay you on what you help them collect. And then Pamela's asked the last question here. Are there any regulatory mandates by insurance companies for doctors to automate? And the question, that is a yes question, because they need to be on an EMR system, electronic medical record system. So they do need that type of automation there.
Okay.
Let's see.
Folks, we're past the hour here, so we're going to wrap it up. If we didn't get you your question, or you're still typing one in right this very moment, we'll pass this on to the people there that sent you the invitation to the webinar, and they can probably answer those questions for you. Meanwhile, if you want to get in this class, very few seats left. Eric, I forget what it is now. It's maybe down to 2 seats.
Two. Correct. You got it.
To do your due diligence, get your paperwork done, and your funding, and get there. Now, if you're just kind of joining us for the first time and you don't want to make that decision or can't yet, maybe you haven't put your funds together, then just be on these webinars. We do them every Wednesday at 4 p.m. Central Time, and you'll be getting emails about those if you just don't opt out of them.
Now, Patrick, I think for those that are on the call today, and if you're thinking about what are we going to be doing next week, I think you've got an interview arranged next week. Is that correct?
Yes, I have a licensee lined up to tell their story. It's a great story of success. We do these every once in a while, folks, and there's nothing that we can do to convince you that this is a good business more than just listening to somebody who's done their due diligence, invested, came down, set to the training, went out, built their business, and now they're making money. That's the best thing you can do, is just to hear those people's stories. And since it's live, you'll be able to ask that person questions during the webinar as if you were just sitting right there talking to them one-on-one.
There you go. Folks, again, give us a call here, 866-565-8413. Talk again with your business coach. If you don't know who your business coach is, just call that number, and we'll make sure you get assigned to someone. If you've got questions that we didn't get answered today, we're going to take care of those one-on-one with you. Patrick, thanks for taking your time. Even though you had a little bobble there, I'm glad you popped back on here at the end. So thanks for taking your time today.
You bet. Thanks again, Eric, for hosting it.
Everybody have a good afternoon. Goodbye.